So I wanted to give you my opinion on something called the Alkaline Diet. There's just a lot of confusion on pH, so I'm just going to give you my viewpoint on it. Every different part of your body has a different pH, okay? The blood operates between 7.35 and 7.45. This is a very narrow band of pH. And anything above 7 is alkaline. Anything below 7 is acid. So the blood is just slightly alkaline, okay? But the large colon is acidic. The urine is acidic. The stomach is acidic. So when you're supposed to avoid foods that are acidic and consume only foods that are alkaline, assuming that you're more healthy in an alkaline state, well, what about the large colon and the stomach? Should we make that alkaline too? And of course, disease and cancer is more acid. So all we have to do is alkalize you to get you healthy. So here's the most important thing you need to know. The pH factor in food is not what makes that food healthy. It's not the pH. It's the nutrients in that food. You got carbs, proteins, and fat, right? Proteins are amino acids. Fat is made up of fatty acids. Should you avoid that as well? Because those are acids. Your DNA, your blueprints inside your cells are nucleic acids. If we actually make the entire body alkaline, nothing would work. Because one of the big functions of having different parts of your body, tissues or fluids at different pHs, is that it allows things to flow. It allows things to be transported in different directions, especially inside the cell, outside the cell. From the stomach, through the small intestine, through the large bowel, the different pHs allow things to happen from a chemical standpoint. So by alkalizing the entire body and trying to make everything alkaline, you'll destroy the stomach acids, and there goes the digestion. Or you might destroy the pH in the colon. Well, this opens you up for getting infection and having microbes survive, because one of the functions of lactic acid, for example, is to keep the pathogens at bay. One of the purposes of stomach acid is to kill the microbes coming in the body. So if these microbes invade the body, then you're more susceptible to getting an infection. Same thing with urine. You need an acid urine to kill off microbes in the urine. And realize there's just as many symptoms and diseases that occur in an alkaline state as there do in acid state. I mean, just look up the definition of alkalosis. You have respiratory alkalosis and metabolic acidosis. Here are some symptoms. Hypokalemia, that's low potassium in the blood. Confusion, tremor, twitching, numbness, just to name a few. All right. Problem solved. Okay, where was I? You're going to have problems if the body is too acid, just as much as you're going to have a problem with the body being too alkaline, okay? And the food that you eat really does not determine your pH as much as you think. You just need to focus on eating healthy, and the body will bring it into the exact pH it needs to be in. And just by not understanding the different pHs of the body, you might think that I just need to drink alkaline water to get my body healthy, and then throw off certain pHs that should be acid but now are alkaline. So anyway, that's my opinion on the alkaline diet, and I'm sticking to it. So if you want more knowledge on how to create a healthy body, subscribe now and get daily notifications. Daily notifications, that sounds weird. Well, I'll just remind you on a daily basis. How about that?